All right, welcome back, everybody. You know, ADHD, it's often seen as a disorder of childhood, but in recent years, an increasing number of adults have been diagnosed with it as well, Kara.
Yeah, joining us now to talk more about this is Dr. Laura Saunders. She's a psychologist at the Institute of Living. Thank you so much for being with us for our midweek mental health boost, Doctor.
Hello, friends. Happy Wednesday. Yes, and we're talking about the increased prevalence, as it might seem, of ADHD in adults. So many adults out there are saying, oh, I've been recently diagnosed with ADHD, and it's being talked about a lot more.
Yeah, and part, it seems to me that some of these adults are finding their kids get diagnosed and then they realize they had a lot of the same symptoms. Is the bottom line this is a lifelong disorder or a lifelong set of symptoms?
So that's a great point, Kara. And I think it really is very important to point out that it is lifelong. It looks different in children than it does in adults. And it's also really important to note that when you, as an adult, get the diagnosis, they actually have to be able to trace back the symptoms to earlier than age 12. So it's not just like, oh, these symptoms started in adulthood. They have to trace back the symptoms to before age 12. And again, that the symptoms look different in childhood and adolescence than they do in adulthood.
Now, is this becoming more prevalent? You know, are more adults being diagnosed these days, or it's always been there and we're just with advanced science and technology just finding out that this is what we're labeling it now?
I think it's a couple different factors, Scott. It's the decrease in stigma around any mental health issues, I think, is increasing awareness and making the prevalence look different. I think it is Kara's point, like when a child or adolescent gets diagnosed, the parent often says, wait, I think this has been true for me also, and it's been true for my lifetime. So there's a couple different factors that I think are leading to the increase in diagnosis and awareness.
Yeah, and I think, you know, it's great, like a lot of successful people, like the CEO of JetBlue, people have come out and said, I have ADHD, and that's why I was able to create this amazing company or do that kind of thing. But let's talk about the symptoms. What are people noticing, and are they different in adults than kids?
So there's three core areas that need to be highlighted in terms of a diagnosis of ADHD. It's the inattention, it's the impulsivity, and the hyperactivity. So those three core areas. And from these core areas, you take it how attention looks different in an adolescent that's in school and in an adult that's in the workforce. And I don't care if you're working in a factory or you're working at a desk job, inattention will look different because the needs for sustained attention are different. And the same it is for activity. Those individuals that are really kind of motorically restless as children and adolescents are not going to do so well sitting at a desk job and need to sort of create career paths that are going to allow them to be more physically active.
What is the protocol? How do you treat this?
Well, like everything, it always starts with identifying and diagnosing. Once you understand better what's going on, it helps you address the symptoms. Then you look at how those symptoms may be hindering you in your day-to-day functioning. It can affect relationships. If you're impulsive or if you engage in a lot of risky behaviors, you're in and out of relationships, you can be in and out of jobs. So you have to look at how the symptom clusters are affecting your day-to-day life or hindering your functioning.
Well, and I think you and I had deeper talks about this at different times, but, you know, if you are in a job that supports, like, you know, we've interviewed experts who say a lot of ADHD types end up in the media, something where everything is changing and there's deadlines and there's excitement. Sometimes you might need to really adjust your lifestyle to match how your brain works, right?
Exactly. And I mean, as we said, really it starts with understanding yourself, identifying what's going on, understanding yourself, understanding what your strengths and your weaknesses are. And it's many individuals are very, very bright. So we're not saying ADHD, you know, changes some of your potential. It's just matching what your skills and your deficits are with some of the career paths that will help you be successful.
And in adulthood, are the symptoms more subtle than they are for children, or are they the same?
They are more subtle. They also manifest in different ways. I mean, what is difficulty paying attention in school, could be, difficulty sustaining a job or relationships in adulthood. So it's really sort of looking at the symptoms and how they progress through the developmental spectrum.
Interesting.
And medication might be the right thing, right? I've heard some adults who said that once they got diagnosed and started taking a stimulant, it made a huge difference for them.
Absolutely. And ADHD medications are some of the longest studied medications in all of psychiatry. And so the stimulant medication can be extremely effective. It also is important to address a lot of the myths around medication, because taking medication, stimulant medication as an adolescent or child does not make you more likely to engage in substance use. In fact, it makes you less likely.
Yeah, that's very interesting. Well, it looks like you're in a Cineplex in Berlin, so we hope you enjoy the movie that you're about to see.
I'm actually in an executive conference room at a leadership meeting, so I just modified my setting a little bit, but it is a little dark and executive-like.
Well, you look very terrific despite that.
Thank you.
Dr. Saunders, we'll talk a little bit later. We'll actually take a deeper dive, maybe get into the differences between men and women as well on the Kara's Cures
yeah, that's a good
podcast.
point.
Yeah. All right, Dr. Saunders, enjoy your executive conference. We'll talk to you later.
Coming up.